Live from the Washington, D.C. area, it's the Inside Scoop, Emerald Planet. All the ecology news that our viewers want to know. Now, here's your host, Executive Director of the Emerald Planet, Dr. Sam Lee Hancock.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. and the United States as we look around the globe in 144 different nations, looking for the 1,000 best practices, the technologies, the services, and the products that are making a difference as we move through the 21st century. And there are a number of people also that are having a huge impact as we face a planet that's going from 7 billion to 9 billion people by 2050, and looking at how do we provide the proper infrastructure so that 2 billion new people actually have an increased quality of life and not just exist. And we have a gentleman joining us all the way from Macau in the country of China. His name is Neil F. Newton. He is the chairman and founder of what's called Glowing Flying Hospitals. And sitting beside me is John Danner, who is the chairman of the Native American Communications and also a member of the advisory board for Emerald Planet. So John's here in case we lose Neil on the Skype. And Neil, are you with us? Neil, are you with us?
Yes, hello.
Hey, Neil, how are you?
Well, you know, I'm doing well.
Great.
And it's good to hear an American voice again.
Well, it's good to have yours, and welcome to the Emerald Planet in Washington, D.C. And I've just introduced you, coming all the way from Macau in China, and our mutual good friend John Danner sitting right beside me in case we lose you by Skype. But tell us, what is Global Flying Hospitals?
Well, you know, Global Flying Hospitals, when I started this some 10 years ago, I had a vision of being able to take a hospital to the people rather than just doctors flying out to some, operate in some tin shed clinic without good conditions. And I did my homework and I found out that there was already an Orbis, the Flying Eye Hospital, a superb organization. And I thought this is doable to be able to put a hospital inside an aeroplane and fly it to the various regions. But, you know, a lot of things have changed in that time, and now we're completely set up in a different mode. But basically, that's what it is, hospitals inside aeroplanes.
Well, I think it's absolutely fantastic, and as soon as we're able to get the slides that you graciously provided us, we'll share that with our domestic and international audiences. These are really beautiful aircraft. But why do you refer to the Global Flying Hospitals as the new paradigm for medical care and also training in the 21st century?
Well, you know, a paradigm is really a model. It's a new model. Because when you look back at the last maybe, 6, 7, 8 decades, we've all been doing humanitarian work around the globe, but it really hasn't made much difference. In the last 10 years since I started, 92 million children have died simply because they haven't had access to medical care and good food. And, you know, we've got to find a new way of doing things because it's pretty scary when you think about 9 billion people on the planet by 2050. And that's going to bring a whole bunch of problems and challenges for us. So things have got to change.
Yeah, and actually you are one of the leaders in that, and it's phenomenal because, you know, there's literally thousands of humanitarian groups all over the globe working in very challenging areas, but it's unique in the fact that you're flying the hospitals into them. So I threw you a little bit of a curveball in the questions because, you know, we're adding supposedly 2 billion new people by 2050. And so how do you as a leading NGO work with opinion leaders, elected officials, policy planners, and even other NGOs to meet the new demands for medical care, training, and then also the nutrition as we go forward over the next 20 to 30 years?
Well, you know, we started out with various visions and various stages that we went through because we was trying to invent as we went. That's a good slogan, invent as we went. But
we'll have to coin that one.
we're just trying to do a hospital inside an aeroplane, and then we realised after the big tsunami in Indonesia and affected the Indian Ocean, there was one group there called Mercy Malaysia, and they were the first on the scene, but they could not get all their equipment over to Asia, to the area that they worked in. And they were using or trying to use the Air Force planes and so forth. And we thought there must be a better way. So we started to look at becoming the logistics resource for various other charities to be able to supply them with flying hospitals and clinics and so forth. But since that time, we've even moved further on, because now we're looking at our platform as a training platform where the medical colleges around the world can get involved and provide curriculum and training and students, and also training of healthcare workers in these countries, because truly to be self-sustaining, there must be a method of training healthcare workers, because we're just not going to be able to cope with another 2 billion people.
Now I'm going to let John jump in just a minute. He's not just a very intelligent, beautiful face and all of this, but going back to the challenges and collaborating with the policy planners, elected officials, and civil society organizations, how do you think that an NGO like yours, Neil, can be a leader in this whole effort so that we're really providing the medical care and the training in the locations where it's really needed?
You asking me? Sorry?
Yes.
Sorry. It's all to do with preventing or presenting a new vision for people, because without a vision you cannot do anything. And if you look at the old methods of doing it, they're becoming dinosaurs in a way, and we've got to think of different ways to reach people and reach the villages and reach the cities and the towns, and how to do things better. Now, we're hooking up with a group in Vermont called MMI, Mobile Medical International, and they've been creating these clinics and hospitals fully certified inside tractor-trailer rigs for years. Orbis approached them, and they're building up a new system, and Orbis is sharing with us of this way of creating these special roll-in and clip-in-place clinics and so forth. So it's like a new way or a lateral way of thinking to come up with something different to be able to address the needs. I think there's still a lot of invention to do, and we've got to think of better ways of doing it.
Okay, Neil, I think we're able to bring up your aircraft, and let's see if we can bring this up on the screen. There we go. There's your airplane coming in, and we'll catch up on the slides. John Danner is with us. We introduced him before, chairman of the Native American Communications, and he's our backup on Skype. John, you have a question.
Neil, I'm thrilled about what you're doing. The way we could get actually to Indian tribes in the early days was having to fly out to them. So now we have better communications. How are you planning for sustainability? Because it costs a lot of money to maintain the airplanes and do that. And I have to bear greetings. The founder of Orbis actually lives about 1,000 feet from my mother. So he's a wonderful guy with a great sense of humor and laying the groundwork, I know. What you're doing is magnificent. How are you going to make this a sustainable operation?
Well, it all comes down to money.
Yeah.
And we eventually, we first started in Florida. But, I'm an Australian, and I was living in Memphis, Tennessee for some 11 years. But unfortunately, I just couldn't get people interested 10 years ago when we started this to, get involved. I guess, this was pre-9/11 and so forth, and people weren't that much interested. So I moved the operations eventually out to Asia. Now, here in Macau, this is a crazy place, and there's some 35 casinos and another 6 under construction and some $40 billion a year rolling in. So we decided to see if we can tap some of that money. And, it's not easy. They don't give their money away, these big groups and casinos and so forth. But this area that we're in is probably the richest place on the planet, the Pearl River Delta and Hong Kong and Singapore and all around this area. But we put in place a whole different funding model, from corporate sponsorships through to our supercar Lamborghini raffles, And of course, we're still accepting donors as sponsors, supporters, and we do ask people to get involved with us, and rather than being a passenger in planet Earth, become crew and join us and help us. But it's really like spreading a big, broad base of fundraising, corporate sponsorships, tapping gaming, and doing everything that we can to bring money from all directions and then convert it into medical clinics and hospitals and methods of working with other people.
Yeah, looking at your work also, you've actually joined a very nice, tight alliance with the Kids Against Hunger program, and it really complements what you're doing as far as your medical delivery system, which we have a photograph of one of your operating theaters providing this care. How did you come up with this idea of actually bringing sustainable nutrition in with medical care and training?
Well, actually, it was presented to us by Kelly Barker, our international CEO, because I've been away from the States for a while. But, as I mentioned before, 92 million children died in the last decade. 21,000 children die every single day. And it's not just medical care, but it's good nutrition, good food. And that's what's missing in this world. And if we've got space in a cargo plane to be able to take food to the various regions and the various places that kids are literally suffering, then we'll do so. And I think it's a very good alliance. I think good nutrition, good food, good health care. And there's another charity too that we work with called Owie Bow Wowie. And that's, for the little kids that are suffering diseases in hospital and injuries, and they're lonely and they're scared. And this is just a little soft plush dog that we give them, and brings a bit of joy in their life. Let me just add.
Go ahead. Sorry. I was just going to say Kelly Barker is the one that's leading that organization, and really you do have a very tight collaborative relationship with three excellent organizations, including your own.
Yeah. Let me just say one thing.
We are just about out of time. We're going to have to end. And Neil, thank you for being with us on the Emerald Planet. It's a mighty work that you're doing. We're going to have Kelly Barker is going to talk more about this great organization, Global Flying Hospitals. We just had the president, chairman, and founder, Neil F. Newton, coming from Macau, China, as we look around the globe to create the Emerald Planet.
Good, thank you.
Dozen fractures. And in the next few years, she faces 2 major surgeries to strengthen her fragile bones. She's only 10 years old. Most people don't worry about fragile bones until late in life. For those with osteogenesis imperfecta, brittle bones are a concern throughout their lifetime. Find out how you can strengthen this child's future.
Diabetes is a killer. After I was diagnosed, I didn't feel sick, so I didn't listen to my doctor. Then it struck. I had a heart attack, then a stroke, and I was only 49.
Most people with diabetes also have high blood pressure and cholesterol, which can cause severe heart damage. In fact, 2 out of 3 people with diabetes die from heart disease or stroke.
Don't let diabetes destroy your life.
Call for your free diabetes survival guide. Choose to live.
Thank you, sir.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States, looking for those 1,000 best practices, the technologies, the services, and the products that are making a difference in 144 different nations that we're focused on through the Emerald Planet. And we have a number of people that are making a difference, have been involved for many years, and really are planning towards 2050. This seems to be the break point as far as the Earth is concerned for severe climate change and how we're going to be able to address at the same time to provide the basic needs and an increased quality of life. I want to emphasize that, an increased quality of life for 2 billion new people that are going to be joining us on the planet. We have two gentlemen that are coming in both by Skype. One coming in from Minnesota, the other from Sydney, Australia. Clint Johnson is the International Program Director of Kids Against Hunger. And then we have Dan Owens, who is the Co-Chief Executive Director and Chief Administrative Officer. Dan, we're going to charge you for this title. And he's with International Care Ministries of the Philippines. And I have right beside me a good friend, Rotarian, and a member of the Board of Advisors for Emerald Planet, John Danner, who is the chairman of Native American Communications. So Clint, we're going to start with you. Welcome, and you're coming in from Minnesota and with the Kids Against Hunger. Tell us a little bit about the main vision to address hunger around the globe.
Well, thanks for having me, first of all. But our mission at Kids Against Hunger is to significantly reduce the number of hungry children in USA and feed starving kids throughout the world. We ship meals to starving children and families in over 60 countries, and we do that through partnerships like DAN's in the Philippines, humanitarian organizations worldwide. So we use a network of partnerships in countries all over the world to achieve this.
And we're going to try to bring up a couple of slides here in the minute so we can see some of the people that you're meeting out there as far as the target audiences. And Dan, I know you're focused in the Philippines and you're working through what's called International Care Ministries. Why choose such a far-flung country as the Philippines with hundreds, actually thousands of islands as the thrust of your large nonprofit there, I guess, coming out of Manila to the rest of the country?
Again, thanks for having me on the program. As you mentioned, ICM's sole focus is the Philippines. We were established by a Singaporean lady living in Hong Kong 21 years ago. Many of you may not know that there's about 11 million Filipino workers living abroad as domestic helpers and other professions. So a large number of these workers work in Hong Kong only being 2 hours away from the Philippines. When people come across to the Philippines, the need is compelling. And so when you visit there, like Sharon did, our founder many years ago, she just felt she needed to help. So today ICM works with the poorest of the poor, or ultra poor, as we class them. That's those living well below the UN Poverty Index on less than 50 US cents per person per day. And in the areas that ICM works, there's 10 million people in that target audience in the middle and the southern Philippines.
Yeah, that's just incredible, and I know that there's 3 main areas that you're actually serving in the Philippines, and 10 million people, that's a lot of people, and you say they're living with less than 50 US cents a day. Clint, how many meals are you actually creating, and how do you distribute this across the 3 main areas that are being taken care of through ICM?
Well, Kids Against Hunger has shipped hundreds of millions of meals since it began. But we couldn't do it without our networks and our partners like ICM and other countries, because basically we package the meals in the United States or at our headquarters in Minneapolis. And from there, as soon as it leaves our doors, a container of 270,000 meals arrives in Manila. And then we rely on people like Dan and their team to distribute those meals to their network that they've established through all their hard work and all the islands. So we couldn't do this without our partnerships, and those partnerships are in every country around the world that we work in.
Yeah, we're going to talk a little further about that, but we have, as you know, a mutual friend and colleague, John Danner, and so he's not just another handsome face amongst us. We're going to let him have the next question. John?
I am the Vanna White of this show. Dan, the question came up, how do you measure the success, and how do you see that the partnerships have really accrued to the benefit of the success for your outreach? Obviously, you know, one part is providing food, and Clint and some of the groups like Kids Against Hunger have provided. How do you measure success? Is it by the individual, or how does that work with your group?
Yeah, that's a good question. We see ICM different from many NGOs by the metrics and the survey data we capture from our programs. Last year, we surveyed 20,000 program participants, and we asked them the same 106 questions pre, post, and 9 to 12 months after the completion of our program. So we can learn, improve, and really celebrate the success from the effectiveness of our programs. For example, our malnourished children's outreach program, as well as feeding in our community transform projects, we have amazing results. 93% of the children post our MCO, or our malnourished feeding, have been measured as heavily healthy and back to normal weight. We've learned that early intervention, as well as educating the mothers, is a sustainable cure. We not only measure this in our malnourished program, but we measure across all the programs that ICM runs. And we know that partnership with Kids Against Hunger is the key to that. That nutritious food is the secret sauce, as well as the education that we give the mothers to prevent bad malnutrition, bad health and hygiene, and practices that they really need to be taught and focused on.
Well, I'm glad you talked about Dan, because that's a perfect segue right into the next question. We talked about the title for this program, the Nexus of Nutrition, Health, and Education, and Nurturing New Generations of World Citizens. So looking at that, what other programs do you have that actually dovetail, Dan, in through your program in the areas that you're serving in the Philippines?
Yeah, we combat the severe poverty really with 3 strategic programs. So this year we'll run 600 plus community transform projects, as we name them. So we find a local pastor who is basically the community leader. We have a network now of about 4,000 rural pastors. That pastor will sign up for a 16-week ICM transform program. He'll select 5 counselors or people to help him in the church to run that on a weekly basis. They'll then go out with a poverty scorecard and select 25 poorest of the poor families in their local community. They'll bring them together for half a day a week's training. We supply the pastor with everything he needs, and his counselors. We do in-depth training with them. And then weekly, ICM will send to the field a health and livelihood trainer, and they will undertake, as we call it, VHL, Values, Health and Livelihood, from an ICM curriculum that we supply these guys.
Yeah,
so
I'm sorry, go ahead.
So they learn Christian values, but really hope, direction, working in a community, principles of honesty and integrity. And then you switch over to health, where they're learning basic health and hygiene from the World Health Organization's guidelines that we've adapted to the rural Philippines. And then livelihood is basic business principles, small business, kid opportunities, micro savings, and much more.
I was just going to say, this will be some excellent best practices that we can highlight when we're traveling in the Philippines for the Emerald Planet and Emerald Planet TV. Clint, I'm going to add another question. We were going down to the impact in other countries and regions, but let's back up and talk a little bit about the food packet itself. What is the international standard, and actually what goes into these food packets, and then maybe share a little bit about how do you actually package these things to ship them halfway around the globe in order to put them in the hands of these people that are earning less than 50 cents a day?
Okay, well, there's 4 main ingredients in the Kids Against Hunger meal. That's rice, soy, vitamins, and a vitamin powder, and dehydrated vegetables. And the soy is the protein, and it has a lot of protein, even more than, and by weight compared to red meat, even more than that. And it's soy, so it's a vegetarian meal. And then the rice is recognized all over the world as a staple of many cultures, so that's easy there. And it also helps fill the stomach. And the vitamins are really the key component to that. There's 21 vitamins and minerals in each packet. and then the vegetables is an additional, coloring and a little extra vitamins there. And the way it's packaged is, we just actually had a million meal pack in DC last week, and they can be anywhere from 10 volunteers to a few thousand volunteers come together in a packaging line, and they scoop each of the ingredients into a meal, and they box them up, and then from there we palletize them, put them on a truck, and ship them to our partners. So these types of events can be hosted at any community, big or small, any corporation, church, school, and it's basically all the volunteers do all of the work.
And I would assume you include any communities of faith who want to be involved in this
Yep.
humanitarian work. But what has been some of the impact? We were talking about with Dan the impact in the Philippines and the good things going on there. But what are you seeing in other countries and other regions around the globe concerning the Kids Against Hunger, and how you've been able to make a change in those societies?
Well, we also put some of our meals away for disaster relief. So if it's East Africa or it's the West Africa, or if it was Haiti after the earthquake, we have meals ready to go. So these people wouldn't be receiving any meals otherwise, and so those meals are delivered to them right away. And we have help from programs with the U.S. Navy called Project Handclasp and other programs. So they'll get food right into the country, bypass any problems at customs, and get them right into their hands. And a lot of these programs, besides disaster relief, are through schools. So these kids might not be going to school, but if they're guaranteed a meal every day, they're going to show up for school, and they're going to be fed a highly nutritious meal that allow them to become the future of their country. So they're getting education, they'll come in for their meal, and they'll come back every single day for that meal.
We have to be quick, gentlemen. We only have about less than 30 seconds. Dan, what do you see of your efforts over the next 5, 10, 15 years? And quickly,
ICM's in a real growth phase at the moment. We are trying to grow 5 times in the next 10 years. So we currently have 350 full-time Filipino staff, 5 foreigners, and a budget of about $8 million. And we want to grow up to about $25 million US budget, 1,500 staff, and saturate the middle and the southern Philippines in partnership with Kids Against Hunger and other collaborative partners. That's the secret for our success.
Clint, 5 seconds.
We want more satellites, more volunteers, and more great organizations like Dan's to work with.
Thank you, gentlemen, for being with us. Clint Johnson, of International Program Director, Kids Against Hunger. Dan Owens, who is the co-CEO of International Care Ministries in the Philippines. Thank you for being with us as we look around the globe to create the Emerald.
Art, a universal language, an expression of culture, of self. And now, thanks to Empowered Women International, a way for emerging and established immigrant and refugee artists and artisans to find hope to earn a living while enriching the lives of all of us. Empowered Women International, making a better America every day. For more information on Empowered Women International's educational programs, or to make a tax-free donation, contact cfrip at AOL.com.
Here, kitty, kitty. Here, kitty, kitty, kitty. Here, kitty, kitty.
You'd think it would be easy to tell which kids have trouble with their eyesight. But that's not always the case. Even though 1 in 4 children may have a vision problem, eye doctors tell us the symptoms aren't always so obvious. We do know that 80% of all childhood learning is visual. And without good vision, kids can have trouble learning to read and may fall behind in school. For clues on how to spot the real-life signs of childhood vision problems and what parents can do, visit checkyearly.com. A public service message from the Vision Council of America and Reading is Fundamental.
to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States, looking around the globe in 144 different nations, looking for the 1,000 best practices, the technologies, the services, and the products that are making a difference as we move through the 21st century. And so we have people that are actually looking at this issue as far as how we're going to be able to take care of 2 billion new people that are projected to be on the planet by 2050. So this is becoming a very critical time zone for as we move through the 21st century and looking at how we're going to take care of all these people. So we have two folks that are going to be joining us by Skype. One is Ron Osterbeyer, who is the Executive Director, COO of Kids Against Hunger. And then if we can reach her by Skype, Kelly M. Barker, who is the International CEO for the Global Flying Hospitals. And then our good friend and colleague sitting right beside me is John Danner, who is the Chairman of the North American Communications. Understand that Ron is with us right now and will be joining us. So Ron, are you here?
Yes, I am. Good evening.
Good evening and welcome. Glad to have you here. And our sound engineer is still getting a hold of Kelly, so we're going to start right off. Give us a brief overview of Kids Against Hunger and its mission around the globe. And we're going to bring up a few slides here to show some of the work that you are doing, Ron. Welcome.
Thank you. Well, Kids Against Hunger is an international humanitarian nonprofit group that basically is packaging around 200,000 meals a day that is used and shipped over to 60 different countries. 75% of the meals that are packed by volunteers in 26 states actually get shipped overseas internationally, and then another 25% actually stay in country and help address hunger problems in the United States.
Well, I think it's just phenomenal what you're doing, and the numbers are incredible. I think you said 200,000 meals a day you're actually packaging?
Yeah, we actually are packaging 200,000 meals a day, but when you look at the world hunger problem, and I know you've addressed the issue of future growth, the problem right now is that to feed the world's hungry would be take 1 billion meals a day. So we obviously are making a little bit of a dent in it, but there's a lot more work to do. And with the numbers increasing, a lot more need for volunteers to get involved and help package food to give people the nutrition they need to live a normal life.
One of the things that we have talked about before, but I'd like to bring it up right now, Ron, is what international body may sanction these types of meals, and how that we know that we're providing, the actual needed food, the nutrients, and also just the meeting the taste of people that across different cultures, societies, and people who are used to different types of food groups.
Well, we work with a lot of different agencies. Actually, we just switched our vitamin powder, which is really the main component of our food that has 22 vitamins and nutrients in it, and it now meets World Health Organization standards. If an American were to eat the food, it's basically like eating a rice casserole. They may find it a little bit bland, may find it a little high in salt content, but when it gets shipped overseas, they actually do a lot of different things with the food, which is kind of interesting. So I know in Ethiopia, they add a spice called barberry, which is a local spice. It's added to all the meals, and that helps make them more accustomed to it and eat it. In the Philippines, I don't know if Clint mentioned to you, but one of the groups that they met actually took the food and made it into spaghetti, and I'm not quite sure how they did that, and also made different types of muffins and things with the food. So there are a lot of different uses, and people are very creative with it. The main thing is that you only need to eat a cup of it a day to get all the nutrients and vitamins that you need to grow and develop into a normal, healthy human being, or to sustain yourself as an adult.
Well, that's really very important, and that's what we're talking about. And my understanding is if they have one nutritious meal a day, that is enough to establish so that the brain and the body can actually grow, and then they not only are physically strong, but also at the same time are able to learn. Is that some of the research that you're finding, Ron, in your work?
Yeah, it is. And one of the things interesting is I talked to a food bank in the D.C. area when I was there recently, and she told me that basically 1 in 2 children in the D.C. area are food insecure. And the problem they deal with is, well, do we feed them every day, 1 meal? Do we feed them 2 meals a day? Do we feed them every other day? And I said, well, this is your answer. You can get these kids at least 1 meal a day of Kids Against Hunger food. They're going to grow and mature naturally until they can get on a more stable diet. So we're finding that around the world. There's a lot of different situations. The founder of the organization, his favorite story was going into war-torn Liberia, got off the airplane and asked the nurse to take him to the starving children. And he came across in the hospital 5 children with distended bellies on their last breaths of life. So he quickly mixed the food up into a soup, and he actually saved 4 of them, and those 4 children are alive today. So the food has a tremendous impact, and if you look at our website, you can see stories of kids that ate the food for 10 days and what actually happened to them and how they matured and grew.
Oh, that's absolutely incredible. I think we have Kelly M. Barker, who is the International CEO of Glowing Hospitals. Kelly, are you with us by voice, maybe not by video? We don't have her yet. Anyway, Ron, coming back to you, and this was a question we're going to have for Kelly, but working with your Kids Against Hunger and also the Global Flying Hospitals, how do you see that relationship evolving and the importance of this nexus, again, of not only the nutrition, but also the health care, and then also the education?
1 second.
Well, we're losing Ron. Let's see. We're trying to fix one and losing the other. Ron, are you with us? Okay. John Danner is sitting right beside me, and we'll let the technicians take care of that. John, talk about this this opportunity for bringing together health care and nutrition.
Well, this is extraordinary because the way it came across, and my experience of it was here in D.C. when they were packing with the kids. They brought in about 1,000 kids, and we brought in the mayor and the former ambassador from Haiti, whom they've delivered something like 20 million meals to Haiti. It was extraordinary to see them have fun, work short shifts, have a good time, and go out as heroes, as friends, and they had just done something very important. They'd saved lives. So being able to now team up with the flying crews, I know in the past they had the Navy be able to fly and also deliver some of the meals by ship. So transportation across the United States for those trucking firms to be able to move from one place to a port, for them to be able to move out to a port, this flying is going to be able to help it immensely. When we were doing this, the cost of this can get exorbitant. I think you ought to check back in with Memphis too, because that's the headquarters back down there for the other group. That
Are you talking about Global Flying Hospitals?
That's one, and then that's one to be able to for sure check back in with.
Well, anyway, John, talking about this, being a Native American and working with numerous tribes all across the United States, I know this is something that's been your concern as far as nutrition, within the United States and working with people here. How do you see this balance of let's take care of people at home, back in our own country, particularly with the Native American tribes that you and I have been focused on, and the international? Just share a little bit about that.
Well, let me give you one example. That at our National Congress of American Indians in Albuquerque, Marshall and Sherry Horn and one of their nurses brought a whole truckload of food. We gave that to Joe Garcia, who was at that time the national president of the National Congress of American Indians. He took this back out to 22 pueblos, and many of those pueblos who needed food now have kids who are able to help. And at our next meeting, National Congress, we're going to be discussing how could we have our kids be donors and benefactors rather than the beneficiaries in terms of the international. And having worked internationally in about 22 different countries, I know that right now the need is great, and I think we need to be able to nurture these locations so that each one of these can now become Kids Against Hunger.
Yeah, I know this is what Ron Osterbauer of the Kids Against Hunger is really looking at, working in the Philippines and many other countries, is that now that they've done the feeding programs there, is actually have those same children that are recipients of the food, the nutritious packs, is to actually involve them in packing for other communities, not only in just the Philippines, but in other areas around Southeast Asia and all that. So
schools, orphanages, and churches and after-school programs now can team up with each other. They can see each other via Skype. They can know that they are brothers and sisters and teams now, and if they've received, they can give back, and that's as powerful as the food itself.
That's absolutely fantastic, and I think we may be able to reach Kelly now by Skype. Kelly, are you here? Let's see if we can get Kelly Barker on. She's the international CEO of Global Flying Hospitals. And if not, then John, we're going to continue chatting right here.
Or throw either one of those, and we'll take a swing at either one.
No, we won't take a swing at anyone, but we're going to continue right along. So, looking at involving the Native Americans in this, John, and this is something that you're working on. You have a special project this Thanksgiving around the globe. Thanksgiving for everyone, and Thanksgiving every day of the year, if I remember the broad work of what you're doing. What is this Thanksgiving, and how can the children in these Native American tribal areas actually contribute to other people around the United States and abroad?
We're changing the paradigm for Native Americans and indigenous people to be able to reach out and not just be the beneficiary, but be able to help make a difference in other people's lives. And as to whom much is given, much is expected. Well, we've been given a lot lately, and we've made a lot lately, and so now it's give back time, and we're bringing all kinds of kids into that process so that they can go ahead and adopt a spirit of philanthropy and altruism. And so Thanksgiving for Everyone is literally the follow-on to what the Wampanoags fed the Pilgrims to do with Thanksgiving. We did 20 years of Thanksgiving for Everyone in Tulsa, Oklahoma, filled the food banks year-round with the kids and the tribes, and so nobody had to go hungry. And the issue now is, can we do that on a national basis? Can we do that on an international basis? And that's our faith and belief that we will take Thanksgiving around the world to have it as a holiday, but also you not only share with your family, but your extended family, so that our global family can now be able to share and with each other.
Well, sorry, but we'll actually have another chance to bring up Ron Osterbeyer, Executive Director, COO of Kids Against Hunger, and Kelly M. Barker, of International CEO of Global Flying Hospitals. And sitting with me is John Danner of Native American Communications as we create the Emerald Planet.
One day these rats were playing in the woods. Well, it's some matches and that's no good. Yeah. Listen to smoke before you give it a try. Only you. Don't play with matches. Don't play with fire. Cause there's nothing very funny about rigged out money. Nothing very nice on a homeless mind. So if a gorgeous force is what you desire, don't play with matches. Don't play with fire.
Only you can prevent wildfires.
Fire.
Why don't you just wash your car at home? When I wash my car, everything runs down the street and down into the storm drains. With all the chemicals in the soaps and waxes, the last thing I want to do is poison my own drinking water. At least here, it's all contained and recycled on site. That's why I also take my car in for oil changes instead of doing it myself. I might take a chance on spilling stuff. You know what the best part is? What? More time to kick back and watch the game.
How far would you go to protect the planet?
I want you to build an ark.
Here we go. Okay, that's good. Oh, okay. Ow!
Maybe there's another way.
People, the flood is imminent. Is it too much to ask for a little precipitation?
Go to fightglobalwarming.com to find out what you and your community can do to reduce global warming pollution.
Somewhere around the world, there are men and women of the armed forces risking their lives, helping rebuild communities after natural disasters, collecting toys for needy children, tutoring kids in school. These are your sons and daughters who work to keep us safe, secure, and free. Dedicated men and women who put their country first.
We're back to the Inside Scoop Emerald Planet. Here again, your host, Dr. Sam.
Hello and welcome to the Emerald Planet as we come to you from Washington, D.C. in the United States. I'm Dr. Sam Hancock, the President, Executive Director of Emerald Planet and the Emerald Planet TV. We're looking around the globe for those 1,000 best practices, the technologies, the services, and the products, and also the people that are making a difference as we move through the 21st century. You keep hearing that we're going to have 2 billion new people on the planet, going from 7 to 9 billion souls, and how we're going to be able to take care of them. There are many in the humanitarian areas, as well as policy makers, elected officials, and others. They're saying through the development of the new technologies, the products, and the services, we will be able to take care of these people. We have a young lady who's going to be joining us, very engaged in a number of different humanitarian projects. Kelly M. Barker, who is the International CEO of Global Flying Hospitals. And also she's working with Ron Osterbeyer, who is the Executive Director, COO of Kids Against Hunger. And then sitting right beside me is our good friend, Rotarian, and a member of the Board of Advisors for Emerald Planet, is John Danner, who is the chairman of the Native American Communications. And I think we have Kelly ready to come on by Skype from Florida. Kelly, are you here?
Good evening, Ron. Good evening, John and Dr. Sam.
We're glad to have you, and thank you for the work that you're doing internationally. And we have a photograph of this absolutely beautiful airplane that you're using through the Global Flying Hospitals. Tell us a little bit about Global Flying Hospitals, and why did you get involved with this group, plus Kids Against Hunger?
Well, it's kind of an interesting story. I was living in Dubai in the United Arab Emirates for 5 years, and I was introduced to Global Flying Hospitals with the opportunity to set them up in Dubai 8 and Humanitarian City, which is a very unique unique environment that had been put together by the Sheikh Mohammed bin Rashid Al Maktoum. And what it is it's a hub whereby within 6 hours of flying time, you could, the facilities that are there could be at the epicenter of basically 90% of the world's disasters. Neil Newton from Global Flying Hospitals was interested in establishing in Dubai, and I became enamored with all of his causes and what the mission and vision of Global Flying Hospitals was, as were everyone that came in contact with the GFH mission. I was successful in helping them engage in that particular marketplace, and found that not only is it suited for the Middle East, for Asia, but also for the United States.
Well, look, Kelly, let me interject. We need to go on with our questions here. Looking at you, we have 196 countries on the planet, and why is it really important that we look at this new paradigm that Neil Newton has evolved, looking at these mobile medical facilities, and specifically using aircraft for this as we reach out to a planet that's going to soon have 9 billion people?
It's extremely important when you realize that 80% of all of the health crises in the world are curable. Most of the 9 billion people, probably 6 billion of them, don't have access to medical care. And it will never be economically feasible for them to be able to leave their countries, go to other locations. So really you have to bring it to them. And the best way to do that is by deployment of these sort of mass medical, humanitarian medical aviation that's not just for disasters, that is for ongoing care to develop a healthier planet.
Yeah, looking at it, and we're going to go to the next question, Kelly, and we're going to have Ron join us in the next few minutes. But I know the philosophy that Neil Newton, the Chairman CEO of Global Flying Hospitals, is the blending as far as the health services, nutrition, and even education. But what do you see as the nexus between Global Flying Hospitals and Kids Against Hunger, because you're working now with both organizations?
Yes, and I became totally immersed in both of the messages because most of the people that we're talking about, they also have food insecurity. So they are sick, they've developed diseases. A lot of it has to do with because they don't have ongoing proper nutrition, which the Kids Against Hunger meals provide in a very economical and certainly transportation-friendly methodology of getting those meals to those people in need in developing countries.
Well, it's just really phenomenal, the work that you're doing, Kelly. And you know, John Danner's sitting right beside me, and he has the question that he's going to present to you. And we just really appreciate John, because I know he's been very involved with the Kids Against Hunger and all that work. But John, why don't you present Kelly with the next question?
The next question is a lot of what you just discussed. So let me just say, when you were in Dubai, you were been very successful in your careers. What is it that has brought you to such a philanthropic lifestyle? I mean, many of us have embraced this, but in the middle of Dubai, it doesn't seem apparent, and maybe that's part of the program.
What brought me to it is, although I am a businesswoman with a successful career, I believe I'm really a social entrepreneur also. And all of the nonprofits that I've worked with, or NGOs, I'm always looking for sustainable solutions. The world right now, in the US, we're 1.8 million nonprofits. I've always said that the donate now model is no longer a successful model. We have to find successful solutions of engagement in order to keep good works continuing on. I see that in Global Flying Hospitals. I see that in Kids Against Hunger. A lot of the programs that we're working in contact with are to provide sustainable solutions. And the future for our next generation is that there are upcoming millenniums that are really looking for doing good in their careers. And although I might have come a little late to it, I do see that using your business skills along with these humanitarian opportunities and finding sustainable funding solutions and sustainability is really the only way forward for our planet.
Amen. Kelly, it's just really fantastic to have you with us and to share your vision and the mission that you have personally and also with the two organizations you're working with. We're going to now switch, so we're going to have to say goodbye to you, Kelly. Thank you for being with us. And now we have Ron Osterbeyer is going to be coming up, Executive Director, COO of Kids Against Hunger. Ron, are you here? Well, we're going to soon have Ron with us in just a minute. Looking at what you just heard from Kelly, John, and professionals getting involved with humanitarian work, this is something you've dedicated your life. You could have done many things over the years, and yet you've been involved in humanitarian and social outreach. Why do that and not just go out and try to make money?
I think every one of us here, and including yourself, it brings it to this point. In fact, Ron Osterbauer is a successful gentleman himself, and he can probably tell you just as much. And I think he's back with us again. Hi, Ron. This is John.
Hey, John. How are you doing? Hi, Sam.
Ron. Glad to have you back. Looking at your Kids Against Hunger and what you're moving towards as far as producing abroad and really expanding business opportunities in many countries to where you're actually producing not only just the packaging and all that, but actually the foods in these various countries. Why move towards sustainable local sourcing of ingredients instead of doing it in the current model that you're using right now?
Well, I think one of the things that we're trying to do is kind of a three-phase program. I mean, phase one obviously is important for Kids Against Hunger to get in, get the people fed, and then take them to the next phase of life. And that's why important relationships like Flying Global Hospitals are important, because once we get them fed, they're going to need medical attention and care, and they can provide that. Phase two of our program that we're looking to go in the future is to actually set up packaging stations in other countries that we would actually pay the native people to package food and then take that food to other regions of their country and start the process all over again. Phase one, feed them. Phase two, start some economic development. And then phase three, we're looking at some models where we actually are able to introduce fish farms, aquaponics, things of that sort that would actually allow the natives to grow their own food and become more self-sustainable.
Well, I tell you, that's the lofty goals that you have, and of course that's a very aggressive expansion of your operation. What do you see as far as the improvement with the families, the communities, and even countries where you're trying to help them to be more self-sufficient in food, water, healthcare, all these things? And how do you, in a sense, work yourself out of a job in these countries that have many of these challenges?
Well, you know, I wish I could say that in 4 or 5 years we would work ourselves out of a job, and we know that that's probably not going to happen with the world economy and things the way they are. But I think what's most important is everybody wants to help, everybody wants to get involved. If you look at the problem of world hunger, it's overwhelming and can really be, can kind of say, well, what can one person do? One person, as John mentioned with the DC Pack, packing for an hour, was packaging 200 meals in an hour. So by donating 2 hours of your time, you can package 400 meals and you can help 400 people. So it's really getting the numbers of people involved and getting them to help process and package the product so that we can save more kids from dying and we can save people that are suffering from food insecurities.
Well, you only have about 20 seconds left, Ron, and we're going to lose you. How can people become involved with Kids Against Hunger and also with the Global Flying Hospitals?
Well, you can all go to our website, www.kidsagainsthunger.org. Want to close with one thing. My favorite saying in talking to people always is, it's not the poor that are bankrupt, it's you and I that see a need, have the capacity to make change, and we look the other way. So people, by not looking the other way, can get involved, volunteer, help fund some meals, and help nonprofits really solve these problems.
Well, Ron, thank you for being with us, and John Danner, thank you for being with us.
I appreciate it.
Thank you very much. Glad to have you here.
Dr. Seb, it's always good.
And it was great to have you here because now you were able to cover for all the Skype losses that we had. And thank you for being with us as we create the Emerald Planet.